So one of the ways that women as patients become socialized into this idea of obstetric thinking or accepting that obstetric medicine is right and is commonsensical is through institutions such as hospitals. So Foucault calls hospitals and technology a form of biopower as you can govern bodies through them. So in the 1880s, the first maternity hospital was opened, which was a two-story building at the junction of Victoria Street and Stamford Canal. This is a description of the hospital in the newspaper. The front looks over the grassy plain in front of the European wards, and at the back, right across the valley to the Mount Tabor Range, as pretty a sight as any recovering mother would like to rest her eyes on. Considerable attention has been paid to the ground on which the hospital stands, so that the rainfall and sewage may be rapidly carried away. The building stands high and dry and in a most airy situation. The floors are all concrete with washing gutters. The rooms are designed with rounded corners so as to be easily swept and afford no gathering place for the enemy of surgical cleanliness, dust. Doors and windows all opening onto the verandas. The rooms are almost open air themselves. And when shut up at night, large ventilators near the floor and the ceiling with expanded metal openings give ample air access. So this especially was in contrast to how homes were being described at the time, because they wanted to encourage women to birth in the hospitals, like the clean and airy hospitals, not their stuffy, dirty homes. So after the Second World War, okay, there was a lot of fluctuation of services. After that, there was a post-war baby boom. And then what happened is that although the trend was in favor of hospital delivery, and as seen here by Dr. Tao, the senior lecturer in ONG, he said that every community which has come under the influence of modern medicine has seen this movement away from home towards hospital. And look at the graph from 1930 to 1962. Okay, so just to 1960, there was a huge leap in the amount of deliveries at Kandang Kerbau Hospital. But there was an extreme overcrowding in about 1954 because there were just too many births and the hospital could not cope with the number of postpartum women. So I guess it was a happy problem for them because they really wanted women to come to the hospital, right? So now there's so many coming. So since patients increased while beds did not, no other hospitals were being made available. The obvious and only solution was to cut down on the length of postpartum stay and send mothers home early. And there was the domiciliary aftercare service and also the domiciliary service. So if you want to know more about that, that's in the midwifery video. I'll try to link it here, then you can see more about how that happened. So yeah, you want women to give birth in the hospital, but then now there's not enough staff, not enough doctors and beds. So they still make use of the midwives, but they made sure that, okay, they will birth in hospital and then go home, or for those who had little to no risk, they would just birth at home. So you can see in 1971, there was an article in the newspaper about how on the doctor's side, they wanted women to come to the hospital and make use of this technology. So one of the technologies, this is also pushed by the pharmaceutical industry, where they have certain drugs that they put on the market and they want more people to use it. So they have to manufacture a demand for it. So one of the ways is through mass media. And here we have Dr. Singh from an Indian institute. And he said, although painless childbirth is well within the realms of modern medicine, women in developing countries are not aware of it or did not want it. They accept it as a natural physiological suffering, which they must go through to get a baby. It is time that they change their concepts. Women in developed countries are benefiting from pain relief through anesthetic drugs. Many women whose later deliveries were done without pain told me they wished they knew about the treatment during their first births. But of course, this comparison is it's not really fair because we're talking about births in the hospital also, right? So it's not just about pain versus no pain, but it's a whole different environment. Dr. Singh explained that the treatment needed little equipment and only a team of qualified anesthetists. But first, there must be a demand from society, which should be made aware of its availability. So the treatment he's talking about is drugs injected into the spine through a fine polythene tube. Doses can be repeated in the same way according to the response and need of the patient. So this is a kind of epidural pain relief. Being fully conscious, she can then help by responding well to doctors, and there will be no deterrent effect on the child. The only difference is that the child has been taken out by forceps. So you just saw forceps a few slides ago, but then such deliveries are safe in the hands of qualified obstetricians. So you can see here that they're very optimistic about the skills, the technology of obstetrics. So in that publication of the ONG, Society of Singapore, the president and the honorary secretary wrote an article about what was going on in the 70s and 80s, which was that there were increasing numbers of lawsuits because a baby was being injured by birth at the hospital through medical treatment. So we would call this iatrogenesis. That means harm that has come up from medical diagnosis or treatment. So the ONG Society of Singapore was very concerned about the present medical legal insurance scheme in Singapore. Another doctor also talked about this, and he gave a case study of litigation for cerebral palsy. Apparently at that time, so this was what date was this? 1980 something. One of the most common reasons for litigation, and indeed one that involves the greatest amount of monetary awards, remains cerebral palsy. There is now, so in the 80s, late 80s, there is now established evidence that this unfortunate condition is not the result of events during labor or delivery. So does it mean that, before this they thought it was a result of events during labor or delivery? Rather, in most cases, it is due to a complex interaction of chronic hypoxia, lack of oxygen, genetics, and other environmental determinants such as alcohol, smoking, or substance abuse. The fact that the vulnerability of the obstetrician continues unabated, despite such evidence, is a scandal and needs the urgent attention of societies such as the OGSS. If we are to bring common sense back into medical care, we must stand united in opposition to such unwarranted and unethical litigation. So there was some some things that they proposed, such as a no fault compensation scheme. That means it would pay the parents who would have otherwise sued for cerebral palsy, or introduce a cap to the rate of escalation of awards. So they would just say, all right, we will pay out for this much complaints and not more. In this book by William Heseltine, which was published in 2013, he gave some indication as to why the costs for medical malpractice subscription for obstetricians were very high. So he said that the annual subscription rates and premiums for medical malpractice have been rising exponentially, especially for obstetrics, which was already the high end. It increased from $5,000 a year in 2000 to $29,000 in 2013. So these rising rates reflect increased payouts to patients who were harmed and were willing and able to seek redress through the legal system. So as of 2005, there were still many lawsuits happening for medical harm. So now we're at the end of the 70s, maybe into the 80s, and that those case studies of litigation, and is to show that the way that patients reacted in the face of medical harm in the field of obstetrics was being met with a counter reaction of defensive medicine. So that means that standard protocols began to be put into place, also screening for various birth defects or genetic conditions or congenital abnormalities in order to avoid lawsuits. So that's the end of my video. You would have gotten an idea of how this field of medicine developed over 60, 70 years, and I will see you in the next video.